마syado siyang naging relaxed.
네, 오늘 서울 하늘은 이렇게.
Good morning, good afternoon, good evening. Welcome to Anatomy TV shows. And for today's hottest latest news, we will tackle about anatomical and physiological direction and positions. So one of our students will show and explain to you the anterior and posterior body landmarks. But let me lay down first the importance of why we need to identify and familiarize ourselves with the body position. So first, it will help us to assess, identify, and assess quickly if a patient comes into us and complains about certain pain he or she is feeling. And second, it will be much easier for us to take down notes of we will use it as our nursing jargons. So without further ado, Ms. Rosco and Mr. Gondon, what's the situation out there?
Thank you, Ms. Biala. So, body position or anatomical position is the knowledge of one's body's orientation in space, direction, and extent. They provide a universal means to describe the position of an organism similar to a compass. So let's talk first about anterior body landmarks. This talks about the front part of the body. So in this manner, we will see right from the cephalic is the head, and here we have the frontal or forehead and cranium or skull. Faces or your face. Oculus is the eye. Buccal or cheek is also called buccal. Oris or your ear. The nasus or nose. The cervixes or neck. Oris is your mouth, and mentis is the chin. Moving on to the trunk is also called the torso, is the core portion of the human body that connects the neck and limbs excluding the hands. The trunk is composed of thoraces or thorax, which is your chest, the mammary or your breast. The abdomen is also called the belly region. Umbilicus or the navel. No part of the thoracic is the axillary or armpit. We have the upper limb starting with acromial or the shoulder joint. Now brachium or arm, antecubitus or the front of your elbow, antebrachium or forearm, and carpus or wrist, and the manus or the hand. We have palmar or the palm. The thumb is the pollex, and digits or digital, which is pertaining to your fingers. Now the lower limb we have is causal or hip, and the femur or thigh, and the crural or leg. The pelvic we have the inguine or groin, and the pubis is what you call genital. And lastly, the pedal or your foot containing the tarsal or ankle, digits or toes, and the hallux or your great toe. Whew! That was quite a lot for the anterior view. So now let's go to Mr. Gundol and find out about the posterior body landmarks.
Posterior body landmarks. When we say posterior, it is the back of our body. The things or the body parts we can find in posterior body landmarks is the occipital, which is the back of the head, acromial, which is the point of the shoulder, vertebral, which is the spinal column, brachial, which is our arm, dorsal is the back, cubital is the elbow, and lumbar is the lower portion of the back. Sacral is the area between the two hips. Gluteal is our buttocks. Perineal is the lower area between the buttocks. Popliteal is the back of the knee. Calcaneal is our heel. And lastly, plantar is our sole. So that will be all for body landmarks. I hope you learned something, and someday you will able to familiarize those, because these body landmarks are really important, especially when you are taking medicine course.
Thank you so much, Mr. Gondol and Ms. Rosco. Now, one of our trending news also is the body regions. But before we start in our next topic, don't forget to drink your water and stay hydrated. So now, can I hear the word from Miss Cosido? Please explain it to us.
Now let's proceed to body cavities and body regions. So it is a space or compartment in the body that houses organs and structures. There are a number of different cavities in the body. And now let's start with the dorsal cavity. So the dorsal cavity, as we all know, means back or posterior. So the dorsal cavity is the cavity located in the back of the body. The dorsal cavity is highlighted in red and labeled with a star below. You can see that the dorsal cavity is situated behind the posterior to the ventral cavity. In the dorsal cavity, we can see the cranial cavity, which we can see the skull that houses the brain, and it has cerebrospinal fluid in it. In the dorsal cavity, we can also find the spinal cavity also, which we can find the vertebral column that houses the spinal cord. Next is the ventral body cavity. The ventral cavity is the cavity located in the front of the body, which makes sense because the ventral means front or anterior. The ventral cavity is highlighted in red and labeled with a star below. You can see how the ventral cavity is situated in front of or anterior to the dorsal cavity. The ventral cavity houses the contents within the chest, abdomen, and pelvis. Now, the ventral body cavity is subdivided into two. First, we will tackle about the thoracic cavity features. So the thoracic cavity is the cavity in the chest. It is superior portion of the ventral cavity located above the diaphragm, as highlighted in red below. The thoracic cavity is enclosed mainly by the rib cage, vertebral column, and the sternum. The main contents of the thoracic cavity includes the heart, the lungs, trachea, esophagus, great vessels, and the thymus gland. Next is the abdominopelvic cavity. The abdominopelvic cavity is the inferior portion of the ventral cavity located below the diaphragm, as highlighted in red below. As the name suggests, the abdominopelvic cavity is in the abdomen and pelvis and consists of both abdominal cavity and the pelvic cavity. Now let's proceed to the 4 abdominal quadrants and the 9 abdominal regions. Now let's discuss the abdominal 4 quadrants. The abdominal 4 quadrants are the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. In the right upper quadrant, we can see the portions of the liver, the gallbladder, the kidney, and the small portion of the stomach. The left upper quadrant is the location of the left portion of the liver, part of the stomach, the pancreas, the left kidney, spleen, portions of the transverse and descending colon, and parts of the small intestine. And on the right lower quadrant, it sits the cecum, appendix, part of the small intestine, and the right half of the female reproductive system. And the left lower quadrant houses the majority of the small intestine, some of the large intestines, and the left half of the female reproductive system, and the left ureter. Now for the 9 abdominal divisions. First, we start with the right hypochondriac. The right hypochondriac region contains the right portion of the liver, the gallbladder, the right kidney, and the parts of the small intestine. The left hypochondriac region contains the part of the spleen, the left kidney, part of the stomach, the pancreas, and parts of the colon. Next is the epigastric. The epigastric region contains the majority of the stomach, part of the liver, part of the pancreas, part of the duodenum, part of the spleen, and the adrenal glands. This region pushes out when the diaphragm contracts during breathing. Next is the right lumbar. Right lumbar region consists of the gallbladder, the left kidney, part of the liver, and the descending colon. The left lumbar region consists of the descending colon, the left kidney, and the part of the spleen. Next is the umbilical. Umbilical region contains the umbilicus and many parts of the small intestine, such as the part of the duodenum, the jejunum, and the ileum. It also contains the transverse colon and the bottom portions of the both and left and right and the bottom portions of both left and right kidney. Next is the right iliac. The right iliac region contains the appendix, cecum, and the right iliac fossa. Next is the left iliac. The left iliac region contains part of the descending colon, the sigmoid colon, and the left iliac fossa. It is commonly called the left inguinal region. Lastly, the hypogastric region. The hypogastric region contains the organs around the pubic bone. These include the bladder, part of the sigmoid colon, the anus, and many organs of the reproductive system such as the uterus and ovaries in females and the prostates in males. That is all for my report. Piala, take over.
Thank you so much for that, Miss Cosido. So, for all the listeners out there, are you still with us? Okay, I hope you are jotting down your notes at your home as one of your references to become a teacher-registered nurse. So next, let's proceed to the body position, presenting Miss Makot.
So thank you, Miss Piala. So now, there are 4 major types of body planes that you need to know for most of your anatomy and physiology courses. So there is the easy way to remember the acronym SOF, which means the sagittal, oblique, frontal, and transverse. So first is the sagittal planes, which divide the body into left and right. So let us move to the next plane, which is the oblique planes. In the anatomical position, describe any planes that is not in any of the sagittal, frontal, and transverse. The next planes is the frontal planes. It's vertical planes running from the side to side. It divides the body or any of its parts in anterior and posterior portion. And the last is the transverse planes. It is the imaginary planes that divides the body into superior and inferior parts.
What a very well said explanation, Miss Makot. And now we are in our last destination, the body movements. So, Mr. Robbie, are you there?
So now let's move to the body movements. So body movements is a change and position of the body part with respect to the whole body. These movements are possible because of the joints. Joints are points in our body where 2 or more parts of our skeleton are connected together. Different joints help our body carry out different activities and movements. And now we are going to perform each body movements by dancing. So what are we waiting for? Let's go!